If you look at age groups, this is the risk incidence over here on the left-hand side, and the age groups, you can see that male and females, by the time we get into our 70s, it's about 1/3 of us that are suffering with overactive bladder, so it's very common. How it happens, we actually probably don't really know, but what we know is the bladder seems to become oversensitive or overcontract or a bit twitchy, and that sets us off, and we try and hang on by the base of the bladder where we try and keep the bladder dry, but the bladder becomes a little, I guess I used the word twitchy. You just feel like you need to go all the time, and you're not quite sure why that's happening. But on a more serious side, as these things take hold, they do become a real problem. And if you think about it, you'll realize how much of a problem they can become. You can start to develop pressure ulcers because of moisture, unnecessary moisture. You can start to get a nasty rash, like a nappy rash that babies get. You can start getting all sorts of skin infections, sometimes urinary infections. If you're getting older and you're not moving as quickly as you used to, you can actually stumble and fall and even sustain a head injury. So it is becoming then a serious thing. Or fall and break your hip, and then it really starts to affect your quality of life. So jokes aside, when this thing gets serious, it does get very serious. If you take it a step further, this is the stuff people won't talk about, or sometimes they'll tell us, but they may not tell anyone else. They may become aware that because they leak, that they think that they can smell something, and to them it's as real as anything. You and I might tell them we can't smell anything, or sometimes we can, but sometimes just the fact that they believe they can smell something will start to really disrupt their social activity. They won't go out, they'll stay at home, they'll develop potentially low self-esteem, depression. It'll start to limit everything they do. If they're a bit younger and still working, it might actually affect their ability to work, and if they're older, it might actually lead them into a nursing home. So it does become a very serious problem. In terms of how we assess people, we always take a history. That's just chatting to them, getting some of the relevant facts. We might examine them for things that might lead us to understand why these things are occurring. A urine test is always helpful because sometimes there's infection in the urine, and that's what's setting it off. A bladder diary is something we ask them to keep in telling us how the bladder works, just like when you go to a dietitian, they'll ask you to keep a food diary. And interestingly, in this age of the electronics, there are apps on your phones, for those of you who have smartphones, where you can actually record these things on your phone as you go. That allows us to assess symptoms. We sometimes like to keep bladder charts where we get you to fill in a chart where we ask you to tell us every time you empty your bladder and how much you do empty each time to give us a cycle, avoiding. And sometimes we do blood tests because there are other conditions like diabetes that you may not know you have that might be affecting your bladder. And we check the flows and how much you might leave behind, because sometimes you may not be emptying your bladder very well. I put this up just to remind me that there's a whole bunch of reasons why you might get a twitchy bladder. So in terms of what we mean by local pathology, something in the bladder, like an infection or bladder stones or a growth in the bladder. In terms of metabolic, that's sort of the way our system runs in the body. Sometimes we're just drinking way too much. I mean, some people are drinking 6 liters a day. Now, if you're going to drink 6 liters a day, your bladder is going to play up because you're pushing a lot of fluid through. Diabetes can upset your bladder. Sometimes medicines of various sorts, including fluid tablets called diuretics, can push through too much fluid through your bladder, and we use them often for blood pressure and fluid retention. And other things that are listed there, including alcohol and caffeine. I think we sometimes forget that in this cafe latte culture that sometimes we're drinking just way too much coffee. And that comes up over and over again. I think that's become a real problem in our society with people drinking a lot of coffee because it can actually upset your bladder. And here I just list, without having to go through that, just to be aware that sometimes medications, including some blood pressure tablets called ACE inhibitors, that can make you cough. So you might think the cough's not so bothersome, but the problem is the cough's brought on the leakage issues. In terms of where we start with treating this, well, we always recommend that you start with your GP, whether it's your prostate problem or your bladder problem. But we're very lucky, as has been mentioned. The Trust has trained about 15 nurses in the community. We have nurses in our practice. And what they do is they help us educate you on some of the conservative things, like what are called pelvic floor exercises. These are not exercises you do on the floor. These are exercises you do on your pelvic floor. You can stand and do them if you like. And we educate you about how your bladder works. And there's no shortage of books to help you and websites.